Hello, I'm Dr. Davis, and I'm one of the child and adolescent psychiatrists with the Department of Psychiatry. I'm going to be presenting anxiety disorders today. This is straight from the DSM-5, and I've broken down this lecture into two parts because there are 12 anxiety disorders in DSM-5. So in part 2 of the DSM-5, we have agoraphobia, generalized anxiety disorder, substance and medication-induced anxiety disorder due to another medical condition, other specified anxiety disorder, and unspecified anxiety disorder. Agoraphobia. So this is where patients fear or avoid situations because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms, such as fear of falling, fear of incontinence. This is usually fear of using public transportation, being in open spaces, being in enclosed spaces, standing in line or being in crowds, being outside of the home alone. This disorder is persistent and chronic with rare complete remission, and has severity increases, remission decreases, and the rates of relapse and chronicity increase. It's consistent across the lifespan. Triggering fears may be age-related, those being like the fear of falling, fear of being incontinent. It can cause individuals to become completely homebound. It can cause patients to become demoralized, and as a result, they may abuse alcohol or sedative medication, what we call self-medicating. The prevalence for this is about 0.9% among adolescents and 2.9% among adults in the general community of the U.S. It is also 2 times greater in females than males. Substance or medication-induced anxiety disorder is the direct result of a drug of abuse, a medication, or a toxin exposure that causes the panic or anxiety symptoms. The symptoms may develop during or soon after a substance intoxication or withdrawal, or after exposure to a medication. And the substances or medications must be capable of producing the symptoms. For example, we know that drugs of abuse, stimulants like cocaine, can cause severe anxiety. We know that respiratory medications such as albuterol and those that can increase the heart rate can also cause severe anxiety. Generally, though, when these substances are stopped for any length of time, weeks, months, depending on the half-life of the medication or drug, then generally the symptoms go away. Anxiety disorder due to another medical condition. The prevalence of this is not that clear, but there seems to be more prevalence of anxiety disorders when individuals have chronic medical conditions that they need to seek medical care for more frequently than just your general checkup things. Some of them would be hypertension, diabetes. Fibromyalgia is a big one that I've seen. Probably ulcerative colitis, things like that, when people have a lot of symptoms of their medical condition or painful conditions, they tend to have a lot more anxiety. So this kind of anxiety typically follows the course of the medical condition. If patients have conditions that cause relapsing, say, well, when their condition worsens, then anxiety is going to be worse. But when their condition is doing fairly well, they're asymptomatic, their anxiety gets better. One major thing about this is that the disturbance causes clinically significant distress or impairment in the patient's social, occupational, or other important areas of functioning. Other specified anxiety disorder, this is the one that takes the place of anxiety disorder not otherwise specified. But everybody knows by now that in DSM-5 they got rid of all of the disorder classifications that had not otherwise specified, and now it's calling them other specified. All this means is that the anxiety symptoms just don't quite fit into a specific disorder. Maybe the attacks, don't occur with the frequency that they should, or, there's just, it kind of looks like one, but doesn't fit all the criteria. And so that's what this one is for. Unspecified anxiety disorder is nearly the same thing as the previous slide, called other specified. The only difference here is that if you have other specified anxiety disorder, the provider can choose to say why it does not meet the full criteria for another anxiety disorder. Under unspecified anxiety disorder, you don't have to put anything. It just doesn't meet the criteria. There's not sufficient knowledge of what's going on, and you just need to wait and see how things pan out, see what other symptoms the patient develops in the long run. But they do still have some kind of clinically significant distress or impairment in the social, occupational, or other important areas of functioning. This concludes my presentation on anxiety disorders. Everything that I've presented to you is straight out of DSM-5, as well as some of it out of Kaplan and Sadek's Synopsis of Psychiatry. Thank you.